This will be the venous. This will be the this will be the venous system.
Silence in the set.
We will have the pulmonary vein, which will carry oxygenated blood. It will be next to the pulmonary artery, so it'll be right about here. About here. You will have to, and then it will branch off into the superior and inferior vena cava. The superior will be going up. The inferior will be going down. You'll be able to follow it. Here is the inferior vena cava. All the way, all this blue, going all the way down to here is your inferior vena cava. Let's go back up here. So vena cava branches off into your brachiocephalic, which is this part right here. Your brachiocephalic then becomes your subclavian, right over here, which then becomes your axillary around the armpit. Mine's cut because that's where they put the dye in, and then it becomes the brachial around here. Can't really see it that well, but that's what will happen. The other part of the superior vena cava that branches off will be your external jugular, which we can see right here. It's huge. Your internal jugular is going to be a lot smaller. Now, you're going to have to search for it a little bit. I actually can't really find mine very well on this side. Right here. If you see, we have the carotid next to the vagus nerve, and then you will have the internal jugular. It'll be significantly smaller. Look at that size versus that size. After that, we'll go down to the liver. You will have the hepatic vein. This is not the hepatic portal vein. This is the hepatic vein.
And then basically splits into three.
It will be going into the liver. The hepatic portal vein will be yellow. See right here that's going down, besides the pancreas, this yellow thing coming down from the liver is the hepatic portal vein. Expect you any better review of it? Not really. After that, you would have the superior and inferior mesenteric. Now, what's important about the superior and inferior mesenteric? I don't have it on mine. It would have been right around here. What's important is knowing where either the superior mesenteric artery or vein is, so then you can find the other one. On my cat, you can't. So remember the name, know about where it is, and you can use that. The renal is massive. It obviously goes into the kidney. Now here's where it gets a little bit tricky. You have the inferior vena cava coming down. You see that almost triangle-like thing before it splits? A little bit right there? That's your common iliac. It will then branch off and become your external iliac. Your external iliac will then keep coming down, and this branch will become your femoral vein. Your internal iliac, otherwise known as your hypogastric, will be this one branching out right here. And your caudal or medial sacral is going to be right over by your caudal medial sacral artery. So remember, it's the one that goes back there. So if you look really closely, sorry, it's really hard to get. It's going to be really hard for him to put a pin in, but I mean, it just broke it.
Oh no.
It's okay. It's really hard to put it. It'll be the, if you see there's a little branch coming off right there, and that little blue thing right there, that would have been your median sacral.
Point at it again.
Right there.
Okay, I got it.
Do you want to put the light on?
I got it.
Okay. It's fine. You can't really put a pin in it anyways. Before I did miss the gonads, I believe, in both the arteries and the veins. Here's the trick. You want to find your vas deferens. See your vas deferens right here? little white thing. We're gonna follow it. And over here, you see this red part? That's the gonadal artery. Now, the blue didn't get enough in, so there's no gonadal vein, but it'll be right around this area. It only can go down, it can't go really up. What is it supplying? The male or female genitalia, so it's going to go down. But here's the vas efferens that goes there. And that is your venous.